Prior to this year, dental coverage was extremely limited for Oklahomans on Medicaid. In fact, only emergency tooth extractions were covered through the program. But that's changing. Jason Doyle discusses the improving Medicaid options with reporter Catherine Sweeney from our content partners, StateImpact Oklahoma.
The situation when it comes to dental insurance here in Oklahoma, and there's a lot of Oklahomans that are going without dental insurance coverage right now.
That is true. About half of Oklahomans can't go to the dentist. They don't have dental insurance. We have 4 million people, so that's about 2 million people don't have any way to go get their teeth cleaned or get a tooth repaired or get a filling or get dentures or a replacement tooth. That's just not an option.
So it sounds like this has led to some taking their dental care into their own hands.
I interviewed a few people, including members of the Oklahoma Dental Foundation. It's a nonprofit. They do all kinds of work to get dental services into communities where people don't have access. One of the services is the Mobile Smiles Unit. It's a big, fancy trailer, and they drive it to different parts of the state, and it has a dental clinic inside of it. And the things that they've seen that they told me about are pretty wild. I think the most compelling, the director, John Wilguest, said that he talked to a woman and she said, "Boy, I wish I would have known you guys were coming. A few weeks ago, I had these teeth and they were just hurting so bad I couldn't take it anymore. And I took a bottle of whiskey and a pair of pliers and pulled them out." That's how painful these tooth conditions can be. They can be overwhelming, unbearable. Lawmakers, they actually funded dental benefits, preventative dental, for adults and Medicaid. So that's Sooner Care. Up until this point, that was not available.
The adult limited dental program is what we call it, allows more benefits for adults. So these benefits have already been in existence for children. It's nothing new for children. But now adults can have restoratives such as silver and tooth colored restorations on their teeth or fillings. They can have dental cleanings. They can have fluoride treatment. They can have treatment for gums. And they can have also partials and complete dentures, which is a real big deal because previously they were only allowed to have emergency extractions.
Will there be a copay involved with this?
There is a $4 copay for adults, yes. It does not apply to any emergency services though.
Does there seem to be a lack of understanding of how your dental health affects your overall health?
Yes. Yeah, we act like it's just this, isolated chamber that's part of your body and it can't affect anything else. And I think, for policymakers, they need to be studying that. But, for, you and me, rank and file people, it's kind of hard not to think about it that way because you can pay for health insurance and dental is separate. I saw a joke the other day that was like, they're luxury bones, I guess, because you have to pay extra to take care of those ones.
So the preventative measures that's the best part about this. So you can come in regularly to see your dentist. You can get your teeth cleaned regularly, get fluoride treatment, which helps prevent cavities in the first place. If you don't get a cavity, you never need to lose a tooth, more than likely, unless you get hit in the mouth or something for sure. But you don't have that toothache and pain and all that if you come in regularly and learn how to take care of your mouth.
Your dental health affects your overall health. Dr. David Jones is a dentist from Muskogee that I interviewed. He works on the Mobile Smiles Unit. He said, you only have one circulatory system. You get an infection in your mouth, the blood in your mouth goes somewhere else. That's everywhere else. You only have, one head. Your mouth is in it, but your brain is in it too. Your sinuses are in it too. It's all interconnected.
Catherine Sweeney with StateImpact Oklahoma. Thank you so much for joining us.
Thank you.